You're sick, your head is pounding, your fever has been climbing for 3 days, you need a doctor, so you get one. He walks in, looks you over, and decides the fix is to cut you open and drain your blood. You're already weak, you're already suffering, and now you're losing blood you can't afford to lose. That's medieval medicine. Not a caricature, not an exaggeration. That was the standard of care for over 1,000 years. And it gets worse. Medieval doctors weren't stupid. They were operating inside a framework that made complete sense to them. The framework was wrong, but they didn't know that. It came from Hippocrates, a Greek physician who lived around 400 BC. His idea was simple. The human body contained 4 fluids: blood, phlegm, yellow bile, and black bile. Health meant these fluids were balanced. Sickness meant they weren't. The Roman physician Galen picked up this theory and built on it significantly. His writings dominated Western medicine for over 1,000 years. So when a medieval doctor looked at a sick patient, he wasn't guessing randomly. He was applying a theory that every authority he'd ever read had confirmed. The problem was that every treatment built on that theory was either useless or actively dangerous. Bloodletting was the most common treatment in medieval medicine. Too much blood? Remove it. Fever? Remove it. Infection? Remove it. The logic flowed perfectly from humoral theory. Practitioners would nick a vein in the forearm or neck using a tool called a phleem. Sometimes they applied leeches instead, and they did this constantly, not just for sick people either. In medieval England, healthy people were bled regularly to stay that way. Monasteries had dedicated bleeding rooms. You'd go in, get drained, and walk out feeling like you'd done something responsible for your health. But here's what was actually happening. Blood carries oxygen, immune cells, and nutrients. Removing it weakened the body's ability to fight disease. A patient already burning through energy to fight an infection just lost the army trying to save them. The results were predictably bad. England's King Charles II suffered seizures in 1685. His doctors removed about 24 ounces of blood. They also gave him enemas and mustard plasters. He was dead within days. This wasn't an isolated case. Bloodletting was the first response to almost every serious illness. Plague, smallpox, epilepsy, gout, you name it. And for conditions already causing the body to lose fluid like fever and dysentery, removing blood was catastrophic. Patients who might have survived were dying faster because their doctors were treating them. The practice didn't lose favour until the late 1800s, when a handful of physicians actually ran studies and confirmed it didn't work. That's over 1,500 years of making sick people bleed. Let's talk about surgery. Medieval surgeons weren't physicians. They were barbers. The same person who cut your hair also cut into your body. This wasn't considered scandalous. It was just practical. Barbers had the tools and the steady hands. Medical schools barely existed. Universities in places like Salerno and Bologna were just beginning to teach medicine by the later medieval period. And even then, teaching meant reading ancient texts, not practicing on actual patients. So when someone needed a limb removed or an abscess drained, the barber surgeon did the job. With unsterilized tools, with unwashed hands, with no concept of infection at all, the surgery itself might go fine. The wound that followed was the real problem. Bacteria entered. Fever set in. Patients who survived an amputation often died of sepsis within days. Nobody knew why. The ancient texts didn't mention invisible organisms, so invisible organisms didn't tore into treatment. Here's where it gets genuinely disturbing. Medieval doctors prescribed human flesh, not metaphorically, literally. Blood from a human body was considered a treatment for epilepsy and migraines. Bone oil made by boiling human bones was given to patients with gout. Wealthy patients had access to a particularly prized ingredient: Egyptian mummies. Ground-up mummy flesh was sold as medicine across Europe. Physicians prescribed it seriously. Apothecaries stocked it. Patients paid for it. And it did nothing except expose whoever ingested it to pathogens and psychological harm. There's no framework in which drinking human blood cures a seizure disorder. But because the ancient authorities were never questioned, and because something had to be done for suffering patients, these remedies persisted for centuries. For headaches, some medieval doctors drilled holes in the skull. This procedure is called trepanation. Ancient skulls with bored holes have been found going back thousands of years. In the medieval period, the logic was that drilling released pressure or let evil spirits escape. Sometimes patients survived. The ones who did often survived despite the procedure, not because of it. The risk of infection from an open hole in the skull was enormous. The risk of direct brain damage was real. And the underlying cause of the headache, whether it was a tumour, a migraine or something else entirely, remained completely untouched. The hole didn't fix anything. It just added a new problem on top of the original one. Religion made everything harder to change. In medieval Europe, illness was widely understood as a message from God. If you were sick, you'd sinned, or God was testing you, or a demon had entered your body. Prayer was the first line of defense. Saints were petitioned, relics were pressed to infected wounds. If medicine failed, it wasn't the doctor's fault, it was God's will. This created a system with no feedback loop. When a treatment didn't work, a theological explanation was always ready. The patient lacked faith. The sin hadn't been fully confessed. God had decided it wasn't time for healing. Doctors had no incentive to question their methods because failure had a built-in excuse. Progress requires admitting that what you're doing isn't working. Medieval medical culture had constructed very effective defenses against that admission. But here's the part that doesn't fit the story neatly. Some of what medieval doctors used actually worked. Not because they understood why, accidentally. Willow bark was a common remedy for fever and pain. It contains salicin, which the body converts into salicylic acid. That's essentially aspirin. Honey was applied to wounds, and honey has genuine antimicrobial properties. Garlic appeared in medieval treatment manuals across Europe. In 2015, researchers at the University of Nottingham took a 1,000-year-old remedy for eye infections, garlic, onion, wine and ox bile, and tested it against MRSA. It killed up to 90% of the bacteria in lab conditions. The researchers were stunned. Medieval herbalists had stumbled onto real chemistry entirely by accident. They had no idea why it worked. They thought it worked because of humoral balance or divine favour. But the mechanism was sound regardless of the explanation. And leeches. The same leeches that medieval doctors applied to drain excess humours are still used in operating rooms today. When surgeons reattach a severed finger or reconstruct tissue after a mastectomy, blood can pool in the reattached area and clot before circulation fully restores. Leeches drain that pooled blood and release a natural anticoagulant called hirudin that keeps blood flowing through the healing tissue. Modern hospitals use medicinal leeches bred and certified specifically for clinical use. The medieval doctor used them to remove an imaginary excess of blood. The mechanism was completely misunderstood. The application, in specific circumstances, turns out to be genuinely useful. They were right for entirely the wrong reasons. So why did medieval doctors make everything worse? Because they were working from a theory that couldn't be questioned. Hippocrates said it, Galen confirmed it, the church reinforced it. Any evidence that contradicted humoral theory was explained away rather than investigated. Patients bled out, wounds got infected, human bones were ground into powder and sold across apothecary counters. And the system kept running because no one had the tools, the freedom, or the framework to ask whether the whole foundation was simply wrong. Medieval physicians weren't cruel or careless. They were trapped inside 1,000 years of inherited certainty. That's a harder problem to fix than ignorance. Ignorance at least knows what it doesn't know.